Data from UNAIDS on the global HIV response shows that during COVID-19 and other global crises, progress faltered, resources shrank, and millions of lives were at risk. However, the eThekwini Metro says it managed to retain HIV patients despite coronavirus. The 2021 July unrest and April floods. Recent estimates indicate that 26.4% of KwaZulu-Natal's working age population is HIV positive compared to 15.9% of South Africa's. Our reporter Nobuhle Modise has that story.
35-year-old Dolly Kwabe of Inanda in KwaZulu-Natal contracted HIV 4 years ago. She says when she was diagnosed, the counseling she received was not good enough. Dolly feels she was let down by the provincial health system because she had to process the life-changing experience by herself.
Ngikho-ke happy ngento eyenzakalayo ekliniki. Kwenzakala na ekliniki uyafika namhlanje uthola ukuthi akusetshenzwe. Siwabuya ngakusasa suspend usuku lonke, understand? Okay, musufikile ngakusasa uthole nakhona nangakusasa kuthiwa amanzi awekho akusetshenzwe. Lento ayisiphathi neze kahle ngoba sigcina sesidefault ngisho default.
It's been over 6 months since Dolly took treatment, her reason being the public health facilities are incompetent and leave her despondent.
Ngaya ngiyothatha amagazi. Okay, yabuya ama-results. Babuya igazi elilodwa. Elinye lishone phi igazi alikho. Libe igazi ngoba phela ngwathatha same time ngo-2. Kandikezwa another date ukuthi fanele ngibuye. Mengibuya, okay balithathe-ke igazi. Sengizolanda ama-results alikho futhi. Leyo nto igcina ukuthi isize sesidefault serious. Ngoba kumnandi phela lapha eklinikhi kufanele uvuke. Like vuka ngo-4 eklinikhi uvuka igebengu. Nje uthi uyafika uthola ukuthi uzoza-attend ngabo-2. Kuthiwa namhlanje cela niphindele emuva asisebenzi.
HIV activist Mafiki Ngubo shares the same sentiment as Dolly, saying senior health officials only work with numbers and not actual people.
Since nje ama-flood, Covid, nje kwehle kakhulu ukuthi abantu bathole usizo ngendlela efanele. Yes, ngathi sinyukile isibalo sabantu abadefaultile.
Mafiki says stigmatization remains the biggest issue at public health facilities, adding that those living with HIV are not being educated about the virus.
Amaphilisi uyawathola even ngishushintsho clinic i-treatment awutshela ukuthi sengiyakushintsha ke manje sengikunika le yenza 1 no 2 no 3 isizathu sokukushintshile lesi nalesi yayibona even uthatha amagazi then yabuya ama-test viral load abakuchazeli ukuthi la uright la uwrong no ubona ngabo sebekushintsha amaphilisi ukuthi okushuthi khona abayitholile yebo so maningi ama-challenges esinawo.
Sex work advocacy group Sisonke says even though challenges are the same for sex workers, they suffer a double blow because of the industry they operate in.
People who are doing sex work come across a lot of challenges, which number one, it's stigma and discrimination. People who are doing sex work are not comfortable accessing health services where they are known of their profession, so they prefer to go out of their way in order for them to access services. And also, as you know, South Africa, it's the largest community. So there are issues of long waiting hours if you are in the clinic. There are issues you are not serviced if you come later after 1. If you come a day after that day you were supposed to come, then they will service you at last. So with sex workers and the industry being criminalized, sex workers do not normally have time to wait whole day in order for sex workers to access some health services, because as you know, sex work is a industry where one choose, it's either they are comfortable working at night or they are comfortable working during the day.
UNAIDS says this year's World AIDS Day theme, Equalize, is a call to action, a call for every person to work for practical actions to address inequalities and help end AIDS. This also includes reforming of laws, policies and practices to tackle the stigma and exclusion faced by persons living with HIV. The United Nations says inequalities are unfortunately blocking the end of the AIDS pandemic. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in Durban.